Autism is a developmental disorder characterized by difficulties with social interaction and communication, and by restricted and repetitive behavior. Autism is associated with a combination of genetic and environmental factors. Autism spectrum disorder or ASD can look different in different people. It's a developmental disability that affects the way people communicate, behave, or interact with others. There's no single cause for it, and symptoms can be very mild or very severe. Early detection is key to assist with treatment. Some indication that your child might be on the spectrum are as follow: they don't respond to their name by their first birthday. Playing, sharing, or talking with other people don't interest them. They prefer to be alone. They avoid or reject physical contact. They avoid eye contact. When they're upset, they don't like to be comforted. They don't understand emotions, their own or others. They may not stretch out their arms to be picked up or guided with walking. No treatment has been proven to cure ASD, but several interventions have been shown to reduce symptoms and improve the ability of people with ASD to function and participate independently in the community. April is National Autism Awareness Month. For more information, visit autismspeaks.org.
High-functioning autism is not recognized as a medical diagnosis. Rather, it refers to people with a much milder form of autism who need only minimal supervision and have no intellectual disabilities. With that said, high-functioning autism is still autism and part of its spectrum. Autism spectrum disorder, also known as ASD, is a neurodevelopmental disorder characterized by difficulties with social interaction and communication, like monotonous speech, a lack of eye contact, unusual posture, and repetitive body movements. But all symptoms are not necessarily found in every case. Before we begin, we'd like to make a quick disclaimer that this video is for educational purposes only. Please don't use this video to self-diagnose or diagnose others. With that said, here are 7 things you need to know about high-functioning autism. 1. There are varying levels of autism. Autism is a spectrum disorder. This means that cases of autism are categorized according to degree of severity. There are 3 levels, with level 1 being the mildest and level 3 being the most extreme. Once a child is diagnosed with ASD, the attending physician or psychologist usually tries to gauge their level by assessing their emotional intelligence, social capabilities, and both verbal and nonverbal communication skills. High-functioning autism is known as level 1 autism. Those at this level generally have the fewest symptoms, and so are better able to navigate their academic, social, and work life independently. 2. HFA used to be called Asperger syndrome. For the longest time, only people with very severe symptoms were diagnosed with autism, and it wasn't until the early 1990s that psychologists began to recognize its milder forms. In the past, Asperger syndrome was considered a different disorder altogether, but now, it's been acknowledged that Asperger syndrome is actually the mildest level of autism, and it's still a part of the autism spectrum. People with HPA have an average to high intelligence and normal development of their language, cognitive skills, and age-appropriate self-help skills, which means their autism is much more manageable and has much lesser impact on their day-to-day lives. 3. People with HFA still need support. Even though HFA is considered the mildest form of autism, it does not mean that people with HFA don't need special care and attention. They may have difficulty getting along with others and maintaining meaningful relationships. They still need help understanding simple social cues like humor and sarcasm. Or they may take everything we say at face value and don't feel the need to be mindful of their words like most of us do. And while many of those with high-functioning autism go on to do amazing things, like Charles Darwin, Emily Dickinson, Albert Einstein, Steve Jobs, and Bill Gates, they still need your guidance from time to time because of their tendency to be rigid and unable to comprehend social intricacies. 4. People with HFA are self-aware. Do you strive to be more self-aware? While people with high-functioning autism may have trouble expressing it through their emotions, they're actually more self-aware than you think. They understand the challenges that their autism brings, and they're mindful of their own limitations. They realize their uniqueness from those around them. This self-awareness makes them extremely sensitive to the negative reactions of others. It hurts them a lot when they're outcast, judged, rejected, or mocked for their condition. Because of this, they're also at a higher risk of developing anxiety, depression, and other mood disorders. 5. People with HFA are highly sensitive. One of the most distinguishable signs of autism is a heightened sense of perception and extreme emotional sensitivity. And while people with high-functioning autism do have less trouble controlling this than most, that doesn't mean it's no longer a problem for them. People who have HFA are still incredibly sensitive to bright lights and loud noises, but might not react as suddenly or as overtly. They also have a tendency to get too emotional or panic when they encounter unexpected setbacks. And they can feel overwhelmed by change. They need predictability and familiarity with their surroundings to really thrive and excel at what they do. 6. Not all forms of autism look the same. Whether high-functioning or not, people with autism all act differently. Autism is a disorder with many faces, so you can never be too sure you know all that there is to know about it. Some autistic people may be overly chatty and outgoing, while others are silent and introverted. Some might smile a lot and laugh inappropriately at times, while others come off as rude, harsh, or cold-hearted. People who have autism are still people and can have different personalities from one another. Lastly, high-functioning autism is highly treatable. Yes, autism is usually a lifelong diagnosis, but high-functioning autism is still highly treatable, and those who have it can easily manage their condition. Treatment doesn't need to be as long-term or as intensive for HFA as they are with level 2 and 3 ASD. And the outlook is much more favorable. Psychologists may recommend speech therapy, physical therapy, occupational therapy, sensory training, applied behavioral analysis, and in a few cases, medication to treat depression or excessively high levels of energy. Being someone with HFA does pose a challenge, but while the condition does come with its limitations, it's worth noting that there's a lot of admirable qualities in people with high-functioning autism. They're honest, conscientious, organized, and highly perceptive. And with the right care and treatment, they're able to rise above their disadvantages and have a great life with plenty of meaningful relationships and accomplishments. Were these points helpful in distinguishing HFA from other disorders? Do you know anyone with HFA? Do these help you understand HFA better? Do let us know in the comments below. Also, remember to share this with those you think might benefit from it. Stay tuned for more.
A new combination therapy may help children on the autism spectrum not only develop better social skills, but also maintain them over the long term. Researchers working in the U.S. have discovered that giving young people with autism the drug D.I.Y before teaching them social skills improves their social functioning for months. Training in social skills is widely used to help people with autism overcome social impairment, the defining diagnostic characteristic. Although such training is very effective when delivered, the benefits are often lost once it's stopped. To help prolong the training effects, the researchers looked at whether D.I.Y could help children with autism remember lessons about social skills. D.I.Y has been shown to boost long-term responses to behavioral therapy, but its impact on autism has not been explored. The team held weekly group training sessions for 68 children with autism. The sessions included lessons in greeting others, understanding emotions, creative play, and social conversations. Half the children were given a placebo before each session, and the other half were given D.I.Y. After 10 weeks of training, the two groups showed similar improvements in social functioning. However, 3 months after the training was stopped, the children who received the medication showed continued interest in socializing with others, whereas this interest diminished in those who received the placebo. This suggests that the children receiving D.I.Y were more successful in gaining new social skills. The drug also caused no notable side effects, making it a potentially safe option. These findings offer new hope for families faced with managing autism. Although it is not known exactly how D.I.Y works, the fact that it boosts learning opens a new avenue for improving the lives of children with autism. More research is needed to confirm these findings and to thoroughly explore any safety issues.
So let's look at yet another concern that has arisen lately with regard to the use of SSRIs in pregnancy, and that is a possible association with autism. Some years ago, there were 3 case control studies, one at Kaiser in Northern California, one in Sweden, and one in the state of California called the CHARGE study. All of these were case control studies, tried to control for a number of confounders, and they suggested possible association between antidepressant use in pregnancy and ASD. The Kaiser study found an association only with SSRIs. The Swedish study, an association with other antidepressants as well. And the California CHARGE study, association with SSRIs for ASD and possibly developmental delay in boys. None of these studies suggested that this was enough to explain the huge rise in ASD since the 1980s, and all of them had major problems with regard to confounding by indication. Nevertheless, Science News published a picture of a little boy with a cute little diaper on, and the headline, SSRI use during pregnancy linked to autism and developmental delay in boys. Of course, this caused alarm in mothers and fathers throughout the country, throughout the world. If this were true, this would be a major concern. However, a new large Danish registry study was then published. It looked at data from more than 500,000 children born between 1996 and 2006, looking at nearly 9,000 prenatal exposures to SSRIs with over 6,000 with maternal affective histories. And what they found was, with prenatal SSRI exposure, there was a 2% risk of autism, as opposed to 1.5% without SSRIs. Now, if the data was restricted to children of mothers with prenatal affective disorders, there was no statistically significant risk in ASD with prenatal SSRI exposure. And comparing siblings with and without ASD, prenatal SSRI exposures was not a significant contributor to ASD risk. So they concluded, after confounding factors were controlled for, that there was no significant association between prenatal SSRI exposure and ASD in offspring. Revisiting the issue of autism yet again was a second new Danish study, which also suggested no risk of ASD. This was a large cohort study, and it found that SSRI exposure prior to pregnancy rather than during pregnancy was statistically significantly associated with an increased risk for ASD. They concluded that any increased risk was due to confounding by indication rather than by any effect of SSRIs, such as maternal depression. In other words, maternal depression, not antidepressants, increased the risk for ASD. So, what is the problem with the studies with regard to SSRIs in pregnancy and possible autism association? There are, in fact, no randomized controlled studies of antidepressants in pregnancy. Even though there have been attempts to address issues of confounding by indication, there is still a lot of residual confounding from unknown or unmeasured confounds, genetic, behavioral, environmental. Also, numerous studies cover the same population, so databases are not as large as they seem to be. And these studies actually did not always arrive at the same conclusions. And in fact, some of the studies arrived at conclusions that weren't even explainable by their own data or findings. Most recently, new light has been further shed on SSRIs and the subject of autism. A meta-analysis done in 2017, published in JCP, reviewed prior studies, the 4 case control studies, which did show an association between first trimester SSRIs and ASD, and the 1 better cohort study, which accounted for comprehensive confounders, which found no risk for ASD with first trimester SSRIs. The data also in 2017 included an article that was published in the Journal of the American Medical Association by Sue John and others. and it looked at more than 1.5 million offspring from a Swedish population registry. It accounted for family, timing of exposure, and paternal factors. And they found that first trimester exposure to antidepressants was not associated with a risk for ASD. In fact, unexposed siblings were at equal risk for both ASD and ADHD. So I'd like to summarize for you the recent meta-analyses of prenatal antidepressants and the risk for autism as written in the Journal of Clinical Psychiatry by Dr. Andrade in 2017, an excellent review. And what he points out is as follows. Some studies have found that exposure to antidepressants in pregnancy in general or with SSRIs is associated with significantly increased risk of ASD. But findings diminished in magnitude and significance when data was adjusted for confounding variables, especially maternal mental illness. Antidepressants were associated with increased risk even when exposure was limited to preconception periods, when drugs could never have possibly affected the fetus. He went on to say that just because antidepressants are associated with an increase in risk for ASD, that doesn't mean that antidepressants are responsible for that risk. If antidepressants do increase the risk for ASD, of course, we need to discuss this with our patients. But we have to remind them to keep in mind that although studies do not prove antidepressants increase ASD, it's understandable that women are concerned. Although case control studies may identify associations, they often overestimate the magnitude of risk. The key points then, number one, although some studies suggest an increased risk for ASD or autistic spectrum disorders with prenatal exposure to antidepressants, when confounders are addressed, especially confounding by indication, this risk is reduced and often non-existent. Treating maternal mental illness is important to address women's psychiatric suffering and to reduce the risk for impairment in offspring outcomes due to parental depression, anxiety, and associated maladaptive parenting behaviors.